coming, so we can start our vaping forum tonight. Two of our speakers, Dr. Hussein from our pulmonology department, and Mike Enos, who's a respiratory therapist here. And they'll be talking, and there's some articles in the back if you're interested that are related to the vaping and one of the topics that Dr. Hussein will be speaking about. And Trisha's here from the Board of Health. In air. So she's not going to be speaking, but if you had some specific questions, because certainly there might be information that you're looking for that she can also bring back or might be able to answer, that would be very helpful. But again, if you look at the articles in the back, they have the current stats. So I think that's important information for you right now. So I'm going to let Dr. Hussein start. Thanks.
Thank you for coming, and I think I have looked forward to talking about something that's near and dear to my heart. This question about inhaling different products into the lungs has come up. I mean, I'm a lung specialist and a sleep specialist and an intensivist, and I've been asked these kind of questions for years and years and years. I know that this has suddenly become a hot topic right now, but people have asked me about what I think of inhaling different products, nicotine and electronic cigarettes, or different types of cannabis and marijuana, and I've always said keep the lungs out of it. I've always said this, keep the lungs out of it. We don't know what the consequences are. There's not been enough studies done. And the lungs, I've always maintained the lungs are meant for air, not even oxygen. Some people do need extra oxygen, but even too much oxygen does bad things to the lungs. The lungs are a very forgiving organ, but at a certain point in time, they don't like to get what's not supposed to go there. So that brings me to vaping, and I'm going to be talking about this hot new syndrome that's called EVALI, which stands for e-cigarette and vaping-associated lung injury, and that's what's been causing all this sensation and all across the country, and the illnesses that have been going around in different places and the deaths that have been reported from it. And this is the syndrome that's happening. And my objectives today are to be able to define this particular syndrome and to be able to give you an idea of how common it is, what is the reason why it happens, know what the risk factors are, know what the duration of symptoms can be, know what the other possible diagnoses can be, how we treat this particular problem, what is the follow-up, and what's the long-term prognosis from vaping-related injury to the lung. And I guess you may sort of let people know what the State Department is doing, and then what the CDC, the Centers for Disease Control, is recommending. So by the end of my discussion, you guys are going to become experts on this topic. That's my goal. So what's the definition of vaping? Vaping is the process of inhaling an aerosol that is created by heating a liquid or wax containing various substances, which can be nicotine, it can be cannabinoids, and there can be flavorings in there with additives, which could be glycerol, polyethylene glycol, propylene glycol. There are several devices that are used for vaping, such as battery-operated electronic cigarettes, also called e-cigarettes, vaping pens, or also called vape pods. And then of course I already explained what this terminology EVALI stands for.
So Doctor, you mentioned liquid or wax, but you didn't mention flower, for example, with cannabis. Is that part of this as well?
As long if it's inhaled, yes, it will be part of that.
Okay.
So it came to people started talking about it, cases were reported for the first time this summer. And when I was preparing this presentation, there were 1,400 cases, but now the number of cases has gone up above 2,000. So the number of cases are being reported more and more. There's a lot of cases that are probably not reported because of lack of awareness on the part of medical providers. So a lot of cases of what we think are pneumonias may be evolving. So there may be some underreporting there. Majority of the patients are men, 70% are men, and majority of them are young men, less than 35 years old, but it's an equal opportunity affliction. It can go, there have been cases reported as people as old as 75 years of age. And a good chunk of these patients have prior lung diseases also. A third of them have asthma, have been known to have asthma. We don't know what causes this particular problem. We think that it's not one disease, it's multiple different types of presentations for this because there's multiple different reasons for EVALI to happen. I'm not going to go into naming all these different technical terminologies in there. But just so you know, I put them in there. There's going to be if people want a handout for my presentation, we can get that for them also. The main thing to know is we call it a diagnosis of exclusion. What that means is that if we don't find any other clear-cut reason for it, and there's a history of vaping, then it is EVALI. So if we don't find a clear-cut pneumonia from influenza or bacterial pneumonia or any allergic reaction to mold or something like that. So there's many conditions that can cause similar presentations, but we don't find any of those, and there's a clear-cut history of vaping that is called EVALI. We have to have a high index of suspicion. Because if we don't think of it, we're going to miss it. So therefore, we have to think of it. That's why we're talking more and more about it. So the main risk factor is the inhalation of using an e-cigarette or a similar product. No one particular constituent or part of these different products has been known to be a definite cause. They do recommend that, they do know that the majority of these patients have had some form of THC involved in it. There's about, of all the cases, 75 to 80% have had THC. About 60% of cases have had both THC and nicotine. And a very small minority had no THC but just nicotine. There was at one time people were thinking that vitamin E is a cause of the problem, but that's not been proven for sure. It's unlikely that that's a problem. A higher percentage, a big chunk of these cases have been from devices or products that are being obtained illegally or illicit means, but it has also been reported from commercially available products. So just because it's commercially available and approved doesn't mean that it's absolutely safe. Most of these products have either been aerosolized either with a dripping process. Dripping means that the heating element was dipped in the product and then inhaled. Also, there's a process called dabbing. Dabbing means it's a very concentrated form of the product that's then like a wax-like form that's then smoked in a pipe. That's called dabbing. Again, it's a combination of mixing of the active product with ingredients. The clinical presentation can be purely respiratory. It's typically a combination of respiratory, somewhat constitutional like fever and chills, and some people also have gastrointestinal, like nausea, vomiting, abdominal pain, diarrhea. But most patients have respiratory symptoms, chest pain, cough, shortness of breath, low oxygen levels. And in majority of these patients, 70 to 80% of these patients have required oxygen supplementation. Some of them have progressed to full-fledged respiratory failure requiring life support. So what do we do when we see somebody that we're suspecting that we're suspecting EVALI? Of course, you have to, now I've started to ask my patients, I used to always ask them about inhaling tobacco and chewing tobacco, but now I've also started to ask my patients about inhaling, vaping, and what kind of product are they vaping, what is the actual product that is being used, were there cartridges used or reused, was there homemade stuff used in there or commercially licensed products, was the product concentrated like dabbing, which is that wax-like stuff that people put in a pipe and eat it. When did the person start vaping relative to the onset of symptoms? Usually we say they should be asked about it within the last 90 days if they have vaped or not. How often is the person vaping? Do they use the Valsalva maneuver? I mean, at the end of an inhalation, or take a deep inhalation and bear down, that's the Valsalva maneuver. That can in fact increase the absorption of the product and cause more damage. And is there also inhalation of tobacco, which can also prime the lungs because tobacco would cause inflammation inside and it would actually increase the amount of absorption and damage from the vaping product also potentially. Imaging, again, this is very concentrated, so we'll look at that, but the main thing that we do is either everybody gets a chest x-ray who we're suspecting vaping, and if they're progressively worse and worse and worse, then we do CAT scans also, and the most common findings are shadows and opacities on both sides, and there are very different patterns to those opacities. The guys get this presentation, you read all the technical stuff in there, but I don't want to get into that because it's confusing and it's way too detailed. How do we diagnose it? Like I said, it's a diagnosis of exclusion. We have to rule out infection. So, in fact, most of the time, these patients are very, very sick patients, and till we get all the results back, we do blood cultures, we look for influenza, we check the urine for Legionella, but we don't wait, we start them on antibiotics, because if we wait and there is an infection, then we lose time, and sometimes things get out of control and the dominoes start, and even if we eventually start antibiotics, it can sometimes be too late. Patients keep on getting sicker and sicker and sicker and then won't turn around. So if the patient comes in with pneumonia-like symptoms, we start them on antibiotics till we get all the data back. Some of these patients, if they're getting worse and worse and worse, we start them on steroids also. But the duration of the steroid treatment is usually short. Usually 5 to 10 days is the duration of treatment. Again, there's no good consensus behind any of this. It's all by consensus. This stuff has not been around long enough. This diagnosis has not been around long enough for us to really know what works and what doesn't work. So we call it supportive care. Antibiotics, steroids, oxygen treatment. Oxygen treatment can be something as, if they're not very, very low on their oxygen, it can be something as simple as nasal cannula or mask. If they're very, very sick, we put them on high flow or pressure devices. And if they're really sick and fighting for their lives, they get put on life support.
Dr. Howe, I have a question. If the patient presents as someone with pneumonia, like symptoms, and you say you do x-ray the lungs, and they have all the same symptoms, and you have to rule out by process of elimination how to get to that diagnosis. what does it look like on x-ray? I mean, if you're taking an x-ray, does it look like it could be a lung cancer, or is it fluid, or how do you decipher which, what it is? What road you're gonna take to treat?
Fluid is very uncommon, so that's called pleural effusions. Those are very uncommon. And mass-like, cancer-like pictures are also uncommon. It's more pneumonia-like pictures, or what we call ground glass changes. You know, you take glass and crush it, and you paste it on a picture, and it looks like ground glass. That could be the appearance. It could be pneumonia-like pictures at the base, lower parts of the lung, because some of these products are based on oil, and that sometimes goes down and does more damage at the bases than at the tops.
Is it usually a bilateral picture? It's not always, if you
Typically
saw it in one
bilateral.
lung, you would
Yeah,
not think.
exactly. Typically bilateral, because the inhalation is going to both sides. It tends to spare the edges, so it's more bases and central, and less on the edges, and we don't see fluid as much, and we don't typically see mass-like. There's also something called bronchocentric infiltrates, because it's inhalational, and the inhalation is around the breathing tubes, those are called the bronchi, so the inflammation can be more around those. And those ground glass changes can also be around the bronchi, sometimes more than the periphery. So, but again, these are all very non-specific findings.
But that would give you the heads up that it's probably
Give you-
vaping versus pneumonia.
Yeah, and I think the biggest part is to have that possible, you know, etiology in mind, that there is a possibility. I need to ask this person if they have been vaping. Because if we don't think of it, we're not going to ask it. If we don't ask it, we don't diagnose it. If we don't diagnose it, we miss it. So I think the index, the suspicion should be high, and that's where we start. Let me start asking all these questions. Because there's no really, I do this test and get it. Yeah, there's no specific, like influenza, I do the test and it's positive. There's no specific test. So we call it a diagnosis of exclusion. And you know, that's what it says over there. You have to rule out infection. Of course, like you mentioned, cancer-like picture, you know, that's mentioned out there. You have to make sure that there's no congestive heart failure, there's no history of cancer, there's no. We have to have a high index of suspicion, but not miss these other things. Treatment I already discussed is usually, we almost always put on these guys are very sick, so we put them on antibiotics. If they're getting sicker and sicker, we also put them on steroids. Steroids are not a given. If they're getting sicker and sicker, we put them on steroids also. And then we sort of supportive care, oxygen supplementation, depending on how low their oxygen is. There have been links that have been there by the Centers for Disease Control for the local departments of health. The CDC has requested all hospitals in the state to report any suspected cases, and if possible to have the vaping product so that it can be tested and coordinate the care with the local departments of health also. Serious condition, there have been more deaths than 34. Do you have an exact number of reported deaths?
I don't, I have just what,
I think the number of deaths is more than 40
it's
now.
200 suspected vaping reported to Mass DEP, Department of Public Health. 39 deaths in 24 U.S. states and D.C., three confirmed in Mass. But that doesn't,
It's underreported.
it seems
There's more.
underreported.
There's more. We don't know the long-term outcome. It's a recently diagnosed issue. I think that these patients who've been diagnosed would have to be followed over years and years and years. There's obviously going to be long-term consequences to some of these conditions, especially if it's been a repeated problem. if it's a one-time thing, the lungs can recuperate. Some of these conditions have been repeated, and if they happen again and again, they can leave behind scars, and some patients can be long-term oxygen dependent. Of course, you folks have this printout of this case where this person kept on getting worse and worse and needed lung transplantation. That's the first case I've heard of who required a lung transplant. This person is obviously not going to survive without that. The best advice for anybody is to avoid e-cigarettes or vaping products, especially for the younger people, because the incidence is the highest in that age group, in pregnancy, of course, and adults who smoke. But I think that this should be extended to potentially anybody and everybody till we know more. We have to know more before we proceed. And those who decide to continue to use products, they should be getting commercially made products, but even commercially made products are going to have consequences potentially, so they're not completely risk-free. So I would say, if you don't know, don't go there.
So, when you look at the information that I know that Pam was sent me, so when they call, because I know you had a question about this too, when they say suspected vaping-related illnesses, that means that they're meeting those criteria, and that's why they're reporting them to the state?
Yes. I think that, again, the emergency rooms are going to have to be very vigilant about that. Primary care physicians' offices will have to be very vigilant, because that's where most of these cases are going to end up. I don't think that most of these cases are going to be seen primarily initially by the lung specialist. The lung specialists and the respiratory therapy, the therapists are going to be much more vigilant about something like this, but they're not going to be necessarily the front line, because we see them after the primary care physician has seen them and after the emergency room physician has seen them.
So have we seen, do you know if we've seen any cases in our emergency department?
Not yet.
Not yet.
Now, if we have seen them, we haven't asked the questions. So we haven't had any specific case hospitalized to my intensive care unit.
Because I was at a meeting with people from Health Alliance, and they said that they started to see cases in the emergency room.
And I think that we probably have had cases, not severe cases, because severe cases get hospitalized. We have had some cases.
I'm sure if we drilled down, we could find a couple of cases of ED. The things that make vaping dangerous are the fact that your teenagers can hide these things in their pocket. They can look like flash drives, they can look like everyday items. And let's face it, when kids were smoking 15 and 20 years ago, you knew the minute somebody lit a cigarette. Everybody knows what it smells like. Okay, if somebody's vaping strawberry or cocoa or whatever, it's nothing that's going to trigger your senses to say, uh-oh, my kid or my grandkid or my next door neighbor or whatever, they're vaping, I have to look into this. That's what makes the product dangerous. And if we think about it, up until the ban, you could literally buy this stuff at any convenience store. It was readily available, and they're not marketing to you and I. They're not naming these things cherry bomb because you're going to buy it. They want your kids to buy it. They want your kids to get addicted to it because they want that long-term addiction. They don't want 10 and 15 years. They don't make enough money on this. They're greedy. They designed these things because they want to make money. They don't care about the health. That's why we're here. That's what we do. I mean, okay, in a grim way, it's job security because it's something that's causing business for the rest of us. I'd like them to try and put us out of business. Come up with something healthy. You know, they're not going to do it. You don't make any money that way.
And I think that's what the misconception was when so many people were trying to quit smoking. Nicotine, cigarettes, the tar, and all.
Well, I'm going to pick on Juul for a minute. Everybody saw the Juul commercial for alternative. I was having to go outside and smoke. I was missing my kids' events to smoke. This is safe. I can do it in my kitchen. No, it's not. You're still putting a foreign substance in your lung. It's no safe. That's like saying drinking one alcoholic drink is just as safe as drinking 20 and then crashing your car. Really?
I think it would be water vapor versus smoke.
So, yeah, so that was the big sale, right? But when Dr. Hussein started to talk, he said, keep the lungs out of it, keep the stuff out of lungs. We're putting all of this moisture and all of this vapor into our lungs, and God knows what we're inhaling with it.
I think commercially it is easier to vaporize something with that oil-based and product. That's where I think the danger comes also, but that's why they use that material.
And that's, the question that I had was because recently they had talked about the vitamin E oil and how it settles into the lungs, and now you were just saying that it maybe not the vitamin E oil
It's
so
not
much.
being borne out. It's not that, yeah, maybe the CDC is doing some research on it, they're siphoning money away from certain other places to research on these different products, because the money is limited. The CDC has limited amount of money. They have to do the research on this stuff.
Do you have any data on, I know this is new also, is the medicinal vaping of cannabinoids versus when you see people in the ED that have vaped, somebody else's product that's not regulated by the doctors and the medicinal shops. I'm wondering about that, and if they put, I don't think the medicinal marijuana places are.
No, they're banned right now.
They're banned all across the.
Everything is banned.
I think that there is a little bit of a trend here. And it looks like that younger people are more prone to it, not that older people are completely safe.
Right.
If you look at the data, there is more effect on younger people and men more than women. Maybe it's because more men may be doing it than women. But the data is there's more men than women, younger people more than older people, and people with prior respiratory illnesses are more prone to the bad effects.
So the older people in that group would be the ones that are more compromised with any little kind of.
I have a theory.
Yeah.
My theory is the ones who survive all of this are more resilient. There is something to be said. That rule applies to tobacco also. I mean, if you see an 80-year-old person who has lungs that are gone but is still smoking, they survived all of that. They go on, the brains are sharp, the heart survived it, their lungs are gone, but those are the survivors. So they have some specific inherent genetic thing that protects them from the really exponential damage. Maybe there's something like, maybe there's some genetic predisposition out there also.
I have a much simpler theory than the ED.
But don't go there.
No.
Who in here would be surprised that teenage males are risk adverse? Come on. They take every risk there is, right?
Yeah.
So that's why they're the ones showing up in the ED with the vaping-related injuries. It's not going to hurt me. I'm 15, 16, 17 years old. I'm Superman. Nothing's going to bother me. Uh-oh, I can't breathe.
From a public health perspective, basically, the generation that is vaping is the generation that got their parents to stop smoking.
But that's why the tobacco companies, if you drill down far enough, the tobacco companies own these vaping companies. Why? Because they call them nicotine delivery systems. They don't call them e-cigs and vaping and mods, and those are all the cool terms to get us to talk about it. They call them nicotine delivery systems. They want to create an addiction. We've got a generation of kids and young adults that know smoking is bad for them. Well, the nicotine companies want their money. How are they going to get it, right? They had to create something. Uh-oh, it's bad for you. Really?
They've done a good job.
Right? They really have. They sold the bill of goods to a generation that knew smoking was bad. That's what they did.
So we haven't seen in our area coming into this hospital any significant.
We haven't diagnosed, I think. But maybe we have had them come through. But we haven't hospitalized anybody that we have sort of being able to figure out, okay, this is Diwali. We haven't seen that.
It's really likely that some of the teenagers that we're treating in the emergency room for breathing-related illnesses that don't have a history of asthma, that don't have a known breathing issue, it's really likely that vaping is probably part of it. But if mom or dad are sitting right in the room and they don't want to admit it to mom and dad, they're not going to admit it to me.
We have to have a high index of suspicion.
I think if they come in once, we can call it anything we want. When we start seeing the same patient 2 and 3 times, now we might have to take mom and dad out of the room.
Yeah, I think that's an important point. I think that, I mean, that goes for any presentation, acute presentation, or even in the office presentation. A lot of times, children have to be interviewed separately from mom and dad, for them to be able to tell the physician what's ailing them. And I think the same goes for respiratory illnesses and, questions about vaping. So, yeah.
So when, this is probably too simplistic a question, but when the CDC wants you to be reporting some particular condition, is there something that they do where you put it into your system to say, if I see these symptoms, I should think about this? Or, what prompts a physician with all the myriad of things that they have to think about when you come in because you're not feeling well, to start asking the question or,
I think CDC is very organized.
We can't be the vaping police to check your pockets or.
No, I think the so the CDC is very organized about it. They do send out en masse information to physicians who are registered with us. What they have also done is they have contacted, and I'm sure they have contacted this with all the big organizations through our corporate headquarters. Our chief medical officer has sent out a chief medical officer's letter with all these different information, including the CDC and from the Massachusetts State Department. That specific letter that has been circulated to all the providers, both in the hospital, in the emergency room, and primary care physicians' offices, about these specific things and when in doubt, report. So sometimes I think it has to be done again and again and again before it, because sometimes there's so much information coming towards providers that sometimes we are not paying enough attention to these directives. So it has to be done again. I mean, these forums help. Spreading the word helps through the media, through the different hospitals, and it has to be repeated. Because this is going to be ongoing. This is not
Do
necessarily.
you think that possibly it's more pediatricians right now that are seeing the vaping, or is it across the board?
I think it's across the board. I think it's across the board. I think that pediatricians, of course, talk about tobacco with the teens. I think the awareness is increasing and improving. So this is being talked about also. I saw something on, I don't know if it was Channel 10 or which channel it was yesterday. There was a pediatrician talking about it on TV yesterday, and an emergency room physician talked about it on TV yesterday, and they've seen some bad cases. So there has to be more.
But even raising the age, like town by town, we slowly raised it from 18 to 21.
In terms of who can buy it?
Yeah, and the state, these kids can go online, get it
online.
in China, and you get it from wherever.
They can go to New Hampshire.
Yeah, that was another thing, go to New Hampshire, but I think Pam, our chair of the Board of Health, had mentioned at the last meeting that someone had ordered it online from overseas, and when it came time to confirm the sale, and they had Massachusetts as their address, they said they could not send to that state. Now, that's maybe 1 or 2 conscientious businesses that are overseas, but I highly doubt the rest of them.
I think the approach has to be specific to different age groups. I think that an adult is going to respond differently to what kind of information is coming their way, and a teenager is going to respond differently. Teenagers who have not gotten addicted as yet are a good audience. And I'm talking from my perspective. I was a teenage smoker. I'm a lung specialist. I was a teenage smoker, and my dad caught me many, many times smoking, and I'm talking about 50 years ago, I'm 54, not 50, 40 years ago. He would spank me, didn't stop me, just made it more fun to steal and hide. And the thing that stopped me as a teenager was there was a third-year medical student who had lost his dad to tobacco-related complications, and he went around all the area schools, and he showed this video of this guy who had severe emphysema and couldn't blow a match off this far away from his face. He didn't have enough breath to blow the match off. And that's what stopped me. So I think teenagers, now if I show that to a 67-year-old person who has been smoking all their lives, it's not going to have an impact on that person. There has to be a different way to approach that person.
Like
but a teenager, I can approach in a more graphic way, who hasn't gotten addicted yet, then don't go there. Not because your dad says so, not because it's bad, but this is what it will do.
And I don't think that a PSA for vaping would be as graphic as the ones that we've seen in the last 10 years for tobacco smoking, because those are pretty frightening when you see those.
Yeah, and I think that there has to be some frightening stuff has to be shown, because I think we have to individualize our approach.
One of the things the younger generation seems to be responding to is when you show them money going up in vape smoke. How much money does it cost you to get started? What did you spend to buy that big pen?
But it's usually not their money. When you're 13, 14 years old, it's the parents' money.
Right, so then you hit them with, so all right, you got $20 from mom. You need to make a choice now between your video game and this vaping pen. Do you want the latest and greatest video game to keep up with the trend? Or do you want to explain to your friends you can't play whatever it is because you blew your money on a vaping pen? They tend to think about that for a minute. They're not going to think about the health consequences, because like I said, it's not going to happen to them. So you got to find what's going to trigger them to say, hey, wait a minute, maybe I don't want to spend that $20. And then when they find out, yeah, you bought $20 today, but that only got you through Tuesday. Now you want it, you got to spend another $20.
But do you think there's any pressure among kids? I know I've listened to several parents talk about the fact that their kids will come back and say, we went to this party, and there were a bunch of 13-year-olds, and somebody that was vaping was trying to get all of us to vape, or the vaping on the bus. So do you think that, there seems to be certain ages where there's more social pressures to do
So there's
silly things?
There's always peer pressure, and what you have to figure out at that point is, what can you say to them so that they don't have to say, well, I can't do it because it's bad, because they don't want to say that. Well, I've got a game today, I need to be able to run. Coach told me he'd kill me if he caught me doing it. My older brother said he'd beat me up. I don't think it's cool. There's a few things they can do, but you just really have to hone in on what it is that's going to make them think, maybe I shouldn't. Because you're not going to hit everybody.
Well, you did a presentation to this.
Yep, to 6th and 7th grade over in Lunenburg.
Right.
And I got to tell you, when I asked the 7th graders what they thought of vaping and what they knew about vaping, they came up with names like Nick Stick and different types of vaping. And then when I asked the 6th graders what they called it, one 6th grader actually made me laugh because he said, I call it a death machine. so you just gotta catch what they're thinking about. And to see the difference for me between the 6th grade group and the 7th grade group, when I asked the 6th grade group, what they thought should be done about vaping, they wanted FBI and SWAT teams, and they wanted these big police responses. And then when you talk to the 7th grade, they wanted to take it away. They wanted to hide it. They wanted to replace it with plain water. They wanted to, they had more creative solutions. And that's just 1 year apart in the school system. What really scared me, though, was that 6th and 7th graders knew what vaping was. And I didn't ask them who tried vaping, who in the group had already tried it. I asked them who in the group knew somebody who tried it. And I didn't trigger it to their parents or their siblings or whatever. I didn't want them to feel like they were being pressured. And almost every hand went up in both groups. And that's 6th and 7th grade. You made a comment a few minutes ago that it's not their money. No, but they're already spending it that way. So we have to talk to them. We have to get them to understand that this isn't their father's and grandfather's cigarette. This is something that we're finding really quick responses to vaping where kids that were healthy 2 weeks ago are ill now because they've vaped 3 and 4 times and developed some kind of response to
And
it.
that's the thing is, when I used to smoke, you could read the side of the cigarette pack, you knew how many milligrams of nicotine or whatever, and it didn't really, make you think any different because
Right,
everybody
back.
did it back then. But it took over years and years and years for people to get that damage and for you to see it in another person, a young person that's vaping, like you just said. The damage is happening.
It's happening much quicker.
Rapidly.
So the
But you don't have any way of, you don't have that packaging.
So-
So when they're vaping, they don't know how much they're sucking into their lungs.
One of the slides I showed the kids was 1 joule was equal to a pack of cigarettes. The amount of nicotine in 1 joule was the same as smoking an entire pack of
And
cigarettes.
I have a question about that, on
Yeah,
those
absolutely.
joules. And so how long would it take someone to inhale or expend one of those joules? to smoke like a vapor?
200 puffs?
So it's, so even the puffs is a lie, because
Okay.
you're gonna take a shallow puff, he's gonna take a deep puff, she's barely gonna puff at all, so even the puff count is inaccurate. The problem with these devices is they're easily hidden. There's no test for us to determine that, the kid vaped today. If you come into the ED smelling like a cigarette, I can draw your blood and I can tell you what your nicotine level is. I can tell you what your CO2 level is. I can tell you the effect that's having on you.
But you could smoke a pack of cigarettes, like a lot of people that were former smokers would say, I used to be a pack-a-day smoker.
Yep.
Would you be a joule-a-day smoker, or could you do more than 1 joule a day? I
You
mean, for that.
can do more than one, and that's the problem. So the way we look at the joule specifically is 1 charge. So like you charge your cell phone, and then 6 or 8 hours later you have to charge it again because you run the battery down. We look at a joule specifically as 1 charge cycle is a complete nicotine delivery. So if that takes you 4 hours to get through, then you just smoked a pack of cigarettes in 4 hours.
And does the product, when you buy it, does it have how many milligrams of anything on each? Like I've
It
never
does,
seen
you
it.
know what, it does, but the print is so small. It's not like, if you looked at the side of a pack of cigarettes, the side of the pack of cigarettes told you that these were bad for you.
Right.
You actually have to hunt for this is bad for you
But it
information.
doesn't have how many milligrams of water, vapor, and
No, it doesn't-
nicotine, and
it doesn't
other
break it down like a
benign
nutritional
substances that
label.
are in it.
I don't
No.
think that that's what I would concentrate on when I'm trying to make a point to a specific individual. But I don't think that's, these reactions are not necessarily, I think, necessarily quantity driven. This is that particular specific individual's reaction.
Right, but that's the point I'm trying to make, is the unknown,
Yeah.
that you don't see
We
it
don't-
different, and you don't know how much.
Yeah, I think the way I think about it is the way I thought about it for myself. What made an impact on me as a teenager, and what made an impact, there were 2 things. One is I knew it was wrong. I think that's important, that it should be known that it's wrong to the young people. This is not right. And there needs to be a clear-cut definition of what's right and what's wrong. And there needs to be a black and white definition. That's one thing. And then I think it has to be individualized. Consequences, what are the consequences, and what makes an impact on that particular individual? Everybody's different, we're all unique. How I take information and digest it and react to it is different. I didn't take the spanking as a deterrent. It just made me sort of find more creative ways. But I saw that video with my brothers, my two brothers. We all were at the same auditorium. We saw all the same. We all saw the same video. And then we went back to our dad and we took away his cigarettes from him and he didn't smoke. And so that was the consequence that I understood. But other people may understand it a different way. We have to figure it out. We have to individualize it. But we have to keep talking about it, like Mike is saying. Yeah.
Mike, you said you went to a class of 6th and 7th graders in Lunenburg?
Yes.
I actually went to the Lunenburg school system and did a talk for their 6th and 7th grade classes.
To all of them?
It was two groups of 50 kids. I don't know if it was all the kids or not.
Did they invite you in, or?
They actually asked us to come in, yeah.
Awesome. Are
So-
you doing that with other
Yes,
school
I've
systems?
already reached out to the juniors, middle school for AIR, and we're talking to Groton Dunstable and Harvard and Harvard School. So yes, we're going to get out to all of them because it's important for the kids to listen to this.
That's right.
And Mike has a good message.
Yeah. And it sounds like you relate to them well.
You know what? It was a lot of fun, and it was things like the.
Well, you like them, okay, that's just that.
Yeah, well, I mean, it was a lot of fun, but it was fun to hear their thoughts. Because it's funny, when you don't think about it, when I see kids and they're sick, they just want to be better. But here I went into an environment where they were healthy and they were engaged and they wanted the information. But to hear their thoughts and see what made them stop and think, or what actually lit the spark for them to raise their hand. Let's face it, I don't know about you guys when you were in school, but I didn't want to raise my hand for anything. I sat in the back of the room and I hid. Okay, and these kids were actually raising their hands, or they were speaking out, or whatever it was they were doing, because they wanted to know. And that's awesome. They know smoking is bad. We've drilled that message home. They know. But this vaping thing, this is the cool thing. How can it hurt me? It tastes like cherry, or it tastes like Dr. Pepper, or it tastes like Hawaiian Punch, or whatever flavor it is. And it's funny, because when I said to them, do you want the video game to go up in vape smoke? It even triggered a little bit of the smoking conversation, because I use the word smoke. And there wasn't one person in a group that said to me, oh, smoking is cool, or smoking is good. And a couple of kids said, how do I get my mom or my dad or my grandma or grandpa to stop smoking? And, we spent a couple of minutes on that conversation as well. So it's engaging them on their level and making them understand that if you make this decision today, it might not hurt you today, but it's immediately going to cost you money.
And I hope you get to go into more school,
We will actually go to anybody that wants to, unfortunately, hear me speak. I'm even speaking to the friends of Nashoba here at the hospital tomorrow at their request, and I'm going to use a similar version of the presentation that I gave to the kids. So if you guys, as you leave here today, decide you want a copy of that presentation, reach out.
The presentation is very visual. It's
Yeah, just as he said, I have a sign-up sheet back there, so if you're interested in getting any of the slide presentations, or you'd like copies of these electronically, just let me know. We're not going to do anything else.